Hello, Assalamualaikum everyone. Again, I'll wait for a few minutes everybody to join in, and then we'll start the session. Today's session will be from a different perspective. Till now, what we have done is the live sessions are with the therapist, a different kind of therapist, from speech therapist, then behavioral therapist, then a family therapist. But today's session will be more focused on understanding of how a psychiatrist, from a psychiatrist's point of view, from a doctor's point of view. So what I've done is that I will be asking very basic questions, because I feel like the questions that I'm getting from my members, they are not clear about the basic knowledge and the concepts. So I wanted to keep in that way first, and inshallah I'll keep discussing about more like I involve more psychiatry into my live sessions and on page. But right now, start from the start, I wanted to be very basic. So today's session is again with one of my panelists, Dr. Khushbakht Areeba Qaiser, and she is a trainee in psychiatry in Sydney, and she has done her MBBS from Dow Medical College here, and then she shifted to Australia. So she will be able to give us idea about how a psychiatrist view any kind of a disorder, and how psychiatrists view a neurodiversity, and she can also give us like a comparison between how has she worked here and then she worked there. So what are the cultural differences? What are the struggles she is facing? What are the struggles we face because of those differences? So let me welcome her. Hello. Hello. I think her net is not connected. Yeah, I think her net connection is gone. She was mentioning about some issues in her net connection, but maybe she'll come back again. Okay, so till then, you must have seen the post I posted, what questions I'll be targeting. But if you have any other questions, please do post, and she's going to answer that. And please make sure that she's not here to prescribe medicines. So kindly don't ask questions in which indirectly or directly you are asking about what medicine to give to your child right now on the basis of the symptoms. She can guide you, but she can't prescribe. So keep that in mind, just giving that disclaimer. Let me figure out where she is. Yeah, I think her net is gone. Yeah, she's not even picking up. And one more thing, that I have been listening to all the suggestions. I have been listening and reading to all your feedbacks. So one of the suggestion was to give a description after the live session in the description box, that what was discussed, and giving a little summary in the written form, so that people can even take it like a written knowledge from the live session. So we are going to add that in the live sessions that have been done. And from now onwards, whenever there will be a live session, I will add details about what was discussed in the live session. Really sorry, guys. This net issue is, I think, all over the world, and everybody is facing that. Yeah, she just messaged that she's trying to come back to stream. Yeah, come back on the stream. Sorry, guys. I think she's coming back. Walaikum assalam. Whoever messaged. Let me add her. I think she is now here. Hello, Areeba. Hello. Areeba, can you hear me? Hello. Hello. And I have lost her again. I think her net is not working. Yeah, I think I have lost her. I can't contact her even. So, okay, she is trying again. Really sorry, guys. This technical issue. In the last live session, I think I got disconnected somehow. It's just that not working. Okay, I think she's back. Okay. I hope this time works. Okay. Hello, can you hear me? Areeba, can you hear me?
Hello.
Hello, I cannot hear you. Hello.
I can, but I don't know
Okay.
if you can
Yeah,
because my
now I
internet
can.
is working good.
Okay. Now I can hear you. Okay. So I just gave a little introduction about what this session would be about. Before starting that, those who don't know, Dr. Khushbakht Areeba is my younger sister. And I'm so happy and proud right now because when she became a doctor, I always wanted her to come into the psychology field, and I persuaded her somehow. Thank God, and now she is, and I think now she will understand why I wanted her to be in psychiatry, because this is how we can help the community working together. Anyways, okay. So Areeba, can you introduce yourself?
Okay, so my name is Khushbakht Areeba Qaiser. I'm working as a psychiatry trainee in Sydney Psychiatry Training Network.
Okay. So what type of patients do you deal with, Areeba, right now?
So my main field of working in right now is adult acute psychiatric unit, which usually deals with the people who have just come in with a crisis. That includes mostly suicide and acute psychotic episodes, and anything for which a patient needs to be admitted and cannot be managed at home. So that's my field right now.
Okay. So, Areeba, I will start with the basic question. I think I have heard this so many times, and I'm quite sure you have heard that too. That what is the difference between a psychiatrist and a psychologist?
Yeah, I've heard it many times.
So, can you elaborate on that?
Okay. So the first thing is, a psychiatrist is a doctor who will have a degree in medicine and will have the permission from the country to prescribe medication, while a psychologist will not have a degree in medicine. By that means, psychiatrists would have studied biochemistry, anatomy, physiology, everything, passed medicine exams, hold a medical degree, while a psychologist will not hold a medical degree, only psychology. The other difference would be from a patient's perspective, the role of a psychiatrist would come in when when a person needs medications, a formal diagnosis. Formal diagnosis means something that is recognized by the state. So, for example, in a welfare state, if you want some kind of benefit from the government, because, for example, you have schizophrenia and you want to claim benefits as being of a schizophrenic patient, then the formal diagnosis can only be made by psychiatrists. The other thing would be, other than the diagnosis and the medications, would be the management plan. So formulating a consolidated management plan, a psychiatrist will make that management plan, and the psychologist and every other part of the team can have a part in it. The other thing would be certain type of psychotherapies, which involve psychoanalytics. So not even every psychiatrist can do that, and a psychologist cannot do that. So only specific trained psychiatrists can do that. So other than that, any medication that you're taking, and you also have some other comorbidity. By comorbidity, it means any other disease other than a psychiatric illness, and it warrants taking medication. Any medication that we're giving in psychiatry usually has a lot of side effects. If not any, then at least some side effects, and it's up to the psychiatrist to recognize what side effect profile will suit which patient, and whether a certain medication should be taken with another medication or not. So all of this will come under a psychiatrist. One other special thing that a psychiatrist can do is detain a patient inside a hospital against their will. That's called a mental health act. What that basically means is, in any country, you cannot give any patient any treatment against their will. For example, if a cancer patient says, I do not want chemotherapy, you cannot force them to have chemotherapy. It's their choice, it's their life. While a psychiatrist has the ability to detain someone against their will and say, they do not have the capacity to make this judgment, and as per my assessment, I have the intention of keeping him inside the hospital against their will. So only a psychiatrist can do that, nobody else, not even any other doctor.
So the consent in this area will not be important. If a psychiatrist says that a medication is important, so they have to take it.
Yeah, so that's kind of like a joke when we psychiatrists make amongst each other. If you don't listen to me, I'll put you under the act. So that basically means I'll make you do whatever I want, and you don't have any grounds to say no.
Oh, so do they like obey then, or do they get scared that you guys are threatening me?
We just do that amongst ourselves. It's kind of like a joke because it's a very big responsibility. Putting somebody under the mental health act is a very big thing. Even though we do it on a daily basis, we do recognize how serious it is. So it's just a joke we do amongst ourselves. That's it.
Okay. And Areeba, when to go to a psychiatrist and when not to go to a psychiatrist?
Okay. So coming from a cultural point of view, the answer would be very different. But coming from a medical point of view, my answer would only be, if you have a psychiatrist available, then go see him if you need to.
Areeba, can you be a little louder? Your voice is very low. Can you be a little louder?
Can you hear me better now?
Yeah.
Okay. So if you have a worry, if you have a concern, going to a psychiatrist is always helpful. So any kind of worry, any kind of concern means whether it be an adult or a child or an old person, you have some concern, some even something as little as I don't understand what they're saying. It just doesn't make sense sometimes when they talk. Even if it's something as little as that, you should go to a psychiatrist if one's available in your city. They will just do an assessment and make sure you get what you need. That's it. There is no such thing as going to a psychiatrist could be harmful. I don't believe in that thing, because unless it's a doctor who's not a good doctor, then it's something completely different. But a place like a metropolitan city or any other place with a hospital which has a psychiatry department and has a good psychiatrist, it's always good to go see them. Whether it's a mood disturbance, whether it's only what you think might be a problem and it isn't. And the biggest thing in psychiatry is confidentiality of patients. So one of the main concerns for patients every time I see is, even on a medical certificate, they don't want to say that, look, I saw you, can you please write, I just came here, and not write why I came here. And that's completely understandable. In every field of medicine, psychiatry follows the same. So we take confidentiality very, very seriously. And it's always good to go see a psychiatrist. It's not a label. Nobody is labeling you. Nobody is doing anything. We're just going to make sure if there's anything that can help the person.
Okay, over here, Areeba, one more thing that I think even I wanted that clarity. I remember I was talking to you about it, that should I go to a psychologist or should I go to a psychiatrist regarding Zuren? So I was confused because some people were saying, no, you have to go to a psychiatrist. And then I was thinking, when he doesn't need a medication, why should I go to a psychiatrist? And then people were saying, because he needs a therapy, you need to go to a psychologist. So what's that hierarchy? What is right?
Okay. So if you look at it from this perspective, not everybody lives in a city and not everyone has the means of going to a psychiatrist. So for example, if it's a population of 10,000 in a village, I reckon there wouldn't be a psychiatrist available there, most likely. In such cases, having a psychiatrist appointment in next 1 year, don't stop yourself and continue seeking other help from other people. But do go to a psychiatrist. The reason I'm saying this is because, for example, there is a behavior disturbance in a child or deficits in social interaction. You have no idea what it is. And for example, a psychologist tells you, I think it might be autism spectrum. The only one who can make a formal diagnosis is a psychiatrist. The reason is there are many diagnoses that come in the spectrum, or could be something else being labeled as something else. Plus, a person could have autism plus something else. For example, anxiety is very common in autism. And you would never know that he never needed medications for autism, but he needed medications for something else. So going to a psychiatrist is always necessary for the assessment, for the complete comprehensive assessment. That does not mean that you shouldn't go to anyone else. It basically means a psychiatrist can do a thorough assessment, say if it is autism, what degree of autism it is. If there is dysphasia, which is basically difficulty in speaking, in language understanding, a psychiatrist will be able to tell you whether it's difficulty in understanding of the language or expressing the language, which part of the brain is most effective. Does he need medication? Does he not need medication? If he does need medication, is it worth giving it? Which metabolic profile will help the child? Does he need behavior therapy? Does he need psychologist input? Does he need occupational therapy? So all of these management plans are usually made by psychiatrists. In your case, I would say in developed countries, even pediatricians are very well trained in this, because the waiting time for seeing a psychiatrist in Australia is like 6 months to a year. So usually pediatricians fill the gap. But as far as I know, in Pakistan, pediatricians are not that much familiar because of the lack of the entire concept around mental health. So even if you find a pediatrician who knows around these things, that's really good. Why a psychiatrist only? Usually in Western countries, again, the reason is because people want to claim benefit. So for example, if a child has autism, the mother gets benefits. That includes money, education, everything. In Pakistan, there's no such thing, welfare benefits. So the diagnosis and the label goes away. The thing that lays behind is the need for medications and assessing whether There is, for example, intellectual disability or no intellectual disability. Expressive or receptive dysphasia, that basically means whether he has any language learning problems other than autism spectrum. So many other things, movement disorders. There are 100 other things that basically a comprehensive assessment would rule out.
Okay. So over here, psychologists do the assessments, right? So if I go to a psychiatrist, in their team, there will be a psychologist or the therapist that will do the assessment, thorough assessment.
No. So a psychiatrist will do the assessment. Full stop.
Okay.
The psychiatrist does the assessment. Psychiatrist thinks whether there should be a psychology input. For many patients, we don't need psychology input at all. We think the patient's not well enough for psychology input in the first place. Or we think, look, this person needs some time with occupational therapy first, with this first, with that first. Even when a person is in a very specific state of mind, do we say, okay, green light, psychology now? The assessment is completely done by a psychiatrist. Yes, we will have an occupational therapist or psychologist in our team. It doesn't have to be someone in our team. It can be someone from, for example, you come to me as a patient and say, look, I have a psychologist in the community I really like. I'll say, okay, give me the details. I'll talk to that person. So we can communicate with each other. That happens here as well. So it is not necessarily a psychologist of my team. It can be any psychologist. But the psychiatrist will do the assessment.
Okay. So my next question was regarding that can psychiatrists do assessment and evaluation diagnosis? And then you are saying that yes, they can. So how do they do that?
There are many things. So a comprehensive psychiatric assessment can take anywhere between an hour or 2 hours. And what it would do is trying and understanding everything. So what a psychiatric assessment does is history from the child, history from the family members. Then we do the physical examination. We need to make sure what are the physical aspects that are involved in it, everything. And then we go into the investigations. There are many metabolic syndromes, for example, very rare syndromes in which there are problems inside the cells that cause abnormalities, whether we suspect any genetic abnormalities, whether we suspect any metabolic abnormalities, whether we suspect there is some kind of a disease in the body which could actually be leading to this. So it is secondary to something, not just autism, it is secondary to something. And the other part of this assessment in investigations is basically the family dynamics. So for example, in Western countries, the family dynamics, involvement of drugs or any such thing in the family would be a very important task in assessment. Then after all the investigations, we can actually do an organic workup that would include MRIs, that would include hearing tests, that would include, depending upon the child, we don't have to do everything, but we do
and
everything.
For hearing tests, do I need to go to a psychiatrist first, or can I get it done on my own?
Look, if you've done it on your own and you come to me and say, look, I already had the hearing test done, I'll say, okay, that's great. So I don't have to do it again.
Okay.
So that's fine. But depending upon my assessment, I might ask you to do something else. So I might ask you to do an MRI. I might ask you to do a CT scan. I might ask you to do some genetic test. And then after I rule everything out, I say, okay, I think my concern is autism along with anxiety spectrum. For example, I think your child has autism with anxiety spectrum disorder, or just autism, or just intellectual disability. Depending on what my diagnosis is, I'll make a management plan. If it's about intellectual disability, I will focus on those things. I will not focus on a psychologist. And if my for example, it is a conduct disorder. Conduct disorder basically means a problem in which a child is not listening to their parents no matter what, and is going to form into a personality known as an antisocial personality after an adult. In that case, I will involve psychologist as the first thing. So depending upon what my assessment is, I would go ahead and involve other members.
Okay. And then even next question, I think, which is the most frequently asked, even on my page, that can a psychiatrist analyze everything inside the brain and find the magic cure?
It depends. In some cases, yes. So the thing is, for example, a child is so aggressive, so disruptive, or an adult, They are not able to sit in one place for a minute. If they do get up, if they're not able to listen anything, they break everything they have. They have destroyed thousands of dollars worth of property at their house. They're not able to go anywhere. In that case, if a psychiatrist is able to prescribe one medication that can just hold his hanger back, parents come and say, that's a miracle, you worked a miracle, you did this, you did that, nobody could help us. So they would classify it as a miracle cure, whereas it's not a miracle cure. What you have done is you have contained the aggression and the agitation. The basic problem might still be there, but the agitation is just controlled down.
So that isn't the magic cure, right?
Look, nothing has magic cure in medicine, even if it is diabetes or hypertension.
This is what I wanted you to say. Can you say that again? And can members please listen to this statement?
Nothing has a magic cure. So, look, if Allah bestows you with a miracle, that's amazing. It's amazing. And that's the only kind of miracle I can ever look forward to. When it comes to medicine, whether it's diabetes, whether it's hypertension, whether it's cancer, whether it's anything, whether it's a brain stroke, all we can do is give some medication, try and control it as much as we can. The moment the patient stops taking the medication, it will go on a perfect high. So, for example, if the graph is going upward, patient is getting unwell, we give something, we make it a plateau. And the patient would say, it's a miracle, you held us well. Yes, it's great. But the thing is, the moment they stop taking the medication, they'll go up, they'll go worse again. So, and it also depends on, for example,
is this because of the dependency that the body creates on the medicine? That if I stop taking medicine, then I go back to or start showing like a withdrawal symptoms. So is this dependency?
Medication. That is a very vast topic. When it comes upon the dependence upon medication, it is an extremely vast topic, and many medications do have the potential of addiction or dependence or tolerance. All of these things have different definitions. All of the medications have this different psychopharmacology when it comes to all of that. So that's a very different thing. But if we just stay towards psychotropic medication, psychotropic medications means the medication that are so any medication that is affecting the brain or from being given from a psychiatry point of view is a psychotropic medication. So, for example, the cells in the brain are called neurons. So if any cell in the brain is, in very layman terms, any medication that a psychiatrist will give will have some effect on the cell. Every human being has a different type of cell, has a different type of coatings on the top of the cell on which the medication works. So if, for example, you're my sister, I can expect, some of the cells of your coating will be similar to mine, but it can still be different. So 100 different human beings can have 100 different coatings on their cells. I might have 10 medications. The first one might work well for you. The second one might work well for the other. So in reality, for example, if a person has schizophrenia and they come to me, I'll give them one medication. I'll say, look, this is one of the best ones. But I might give it to him for 6 weeks. It doesn't work. And then I say, okay, that means it's not suiting you. I give you another one. So it can be a very long and lengthy process. We keep trialing medications, but there is no shortcut to know which one will suit you better unless you try it. So there can be very many trials. There can be randomized control trials. There can be many systematic reviews. There can be a lot of research on a specific medicine and how good it is. But depending upon what type of coating your cell has, it can be very good or not very good for you. So for example, a medicine that is not very good according to research trials, but works well for you, you will call it a miracle. But it will happen, depends. And for example, there is one medication in psychiatry that has so bad side effects that it's reserved for the end cases that don't respond to anything else in the entire world. So sometimes a patient who actually qualifies on going on to that medication after 10 years or 3 years of other medications, when nothing else works. And when we finally give that medication, the patient responds and comes back to a complete normal. So that for them is a miracle. So everything can have its degree of recovery, and the perception of miracle can be different for different people, but it does happen.
And like Areeba, there are not two extremes. Like when mothers and parents have approached to me through this page, Either there are people who want to go to a psychiatrist because they believe medicine will cure everything, even if the
Hmm.
child doesn't, according to me, doesn't require any medication. And then there is this another pole that believe that I do not want to go to a psychiatrist. They are going to force medication on my child. What do you have to say about that?
The only um, the only circumstance in which a psychiatrist can force medication is the patient is going to end his life or end someone else's life. That is basically us detaining someone under the Mental Health Act. That is a psychiatrist saying, I need you to take medication whether you say yes or no. You are going to get admitted whether you say yes or no. I can ask the police to come in and take that patient inside my ward. The police will help me get that person inside my ward. So that we only do when a person is a source of threat to himself or a source of threat to others. That is the only time when we say, okay, I'm admitting you, you're going to take this medication whether you like it or not. Okay. And that's where there's the bad side to psychiatry, which media tends to,
Yeah, elaborate on more, focus more
I
on
can
it.
elaborate that, a certain person was given some medications against themselves, but there are only certain circumstances where we do this. And that is when we think either this person is going to go right now and kill someone, or that he's going to kill himself. That's it. Other than that, a psychiatrist can never, ever force any medication on you. It's up to you. There are many people who believe in alternative medications like herbal medications, religious things, kudos to them, whatever they'd like. Nobody can force them.
Yeah.
And then as far as this thing goes that I want to go to them because a medication will definitely 100% cure the child or cure the adult or whoever it is. It's always good to be optimistic, but set realistic expectations.
Yeah.
Just because we can give medication, it might work, it might not work. It's a process, it takes time,
But
and nothing
Ariba,
is
unfortunately, over here, doctors tend to uh, not even help the kid, then actually worsen the case. For instance, there's this mother who approached me and she said that my doctor, I'm not even sure that the doctor was a psychiatrist. They did a blood test, and based on the blood test, they prescribed some psychiatric medications. How is that possible?
as far as I know, no, that's not possible.
That's not
So
right.
look, the first thing is whether it's a psychiatrist, whether it's a surgeon, whether it's a general practitioner, please go to a good one if possible. A
But how would we
surgeon
know?
will
That's the problem, Reba, over here, because
a
you have
good,
worked over here as
a
well.
good
You know the
yeah,
struggle.
it takes time to find a
Yeah,
good match. But the thing is, a doctor who works on anecdotal evidence is something like, you know what, this medicine worked on 10 patients, it will work on you.
so it will, yes.
A person who does not practice evidence-based medicine, who is 70 years old and says, I don't need to study anymore. I don't need to keep up with what's coming up. And I just assessed you in 30 seconds and that's it.
Hmm.
So if there's a person like this that you'd realize, so if I was in that woman's place, I wouldn't go back to that doctor again and just not give the child that medication. Have a second opinion. It's not that hard. So just have a second opinion. Whatever blood results you have, just take it to the other doctor. Say this is what happened. Keep trialing till you actually find a good doctor.
Yeah.
Please don't. Psychotropic medications are medications that are changing chemicals in the brain. It's a big thing, it's a big responsibility. Just don't take that advice from anyone. It's something really important. It should be a doctor who knows what he's doing.
And the most common thing over here is that either, for instance, a child on a spectrum or child having ADHD symptoms, because of this diagnosis, they have this hyperactivity in them. And doctors tend to start giving them sedatives so they are calmed down. And it is very common over here.
That's actually very weird because the treatment for ADHD is not something that calms them down. It's actually a stimulant. So that's
But over here, what they do is that they just to give them calmers and sedatives, so that they're just in one place and they're calmed down, and they believe that okay, if this is happening, so my child is getting better.
just wrong practice.
Okay. Now, Areeba, what role can a psychiatrist play in the treatment of children with learning disabilities or any kind of special needs?
So the first thing that would happen is, after a comprehensive assessment, intervention needs to be planned. So, for example, first of all, I find out, oh, this person does not have a behavior problem because of this, but it's actually a hormonal problem. So I can actually just treat them with hormones. So if it's not a medical problem, then I can say, okay, so it's a purely psychiatric illness with basically no organic platform, just a psychiatric illness. So what I'm going to do is I'm going to give them some medications. And then after those assessments and medications, I can assign a team to help him in any way they can. I can create a platform. So basically, for example, you can think of a psychiatrist as a platform like this page, Team Neurodiversity. So a psychiatrist is the entire team. He can bring everything together.
Okay. And are medications always necessary with treatment in the treatment of children with learning disabilities or special needs?
No, they're not always necessary. So, for example, if a woman goes to a psychiatrist does the assessment and says, look, I think behavior therapy is the main thing that we should go on. Or for
Maybe your
example,
voice is very low. Can you come a little closer? Yeah.
sorry. So, for example, psychiatrist, for example, you're a mother, you come to me, I do the assessment. I, for example, say, look, I think there are some lacks in parenting skills. And I think there's some kind of behavior therapy that the child needs and parenting skills that you guys need. So there are two types of things that happen to this. Either the mother will understand or the mother will say, then what's the point? You're not giving any medication, then why the hell did I bring the child to you? So it's not, medications are not always the answer. Yes, they are the answer. It could be because of one thing, it could be because of another thing. You might think the child just has ASD, maybe he also has post-traumatic stress, you don't know. He's experiencing flashbacks and we need to treat that as well. So depending upon my assessment, I may say he needs medications, I may say he does not need medications. Apparently some doctors give some medications that are not right, that are not correct. In that case, I would just say try and go for a second opinion. Think of it as getting a surgery done. If you think the surgeon you went to wasn't good enough, go to a second one. There's no harm.
Okay. And if they are being given medication, so is medication is the only help they need, or will they need therapy with that as well?
Medication is not the only treatment modality in psychiatry. It never works alone in psychiatry. Never, ever. So for example,
with the children with special needs.
No, medicine is never the only answer. You might imagine, even if it's not just child, for example, a person came to me, just jumped off the bridge, right? Comes to me, he's suicidal. Out of 10 people who jump off the bridge, I don't think even 2 have depression.
Yeah.
It's the same with children. A lot of people might have a lot of problem. It's a possible ADHD might just be one of them out of the 10 that I assess. So, and yes, that person might need medication for some time, but he will need everything else. Maybe he might not need medication for his lifetime. He might need medication for the entire lifetime. It's like saying to a person with diabetes, if you take this medication and have all the sugar you have, you will stay normal. That it doesn't work like that. So if you want to control your diabetes, you have to take your insulin, you have to take your medications, but you also have to stay away from sweets. So if you want to control your behavior problems, you have to take this medication if needed. And then you also have to go with the behavior therapy or whatever else is needed.
Yeah. Very well explained, Areeba. Areeba, one more thing. Can you explain now I think I've covered the topics that I wanted to. What do you think as a psychiatrist, what is neurodiversity for a psychiatrist? What does that mean to a psychiatrist?
Neurodiversity is our job.
Sorry, neurodiversity?
Neurodiversity is a psychiatrist's job. It's our job. That's what we do. That's why we assess people. That's why we try and understand what's happening with the person. It's everything psychiatry is. Neurodiversity is not just a child. Neurodiversity is an adult. Neurodiversity is an old age person. Neurodiversity is a person who's about to die. Neurodiversity is all of them. So it's good that people are now understanding all of these things. There is lesser amount of dilemma. There is lesser dilemma around a psychologist, but somehow the dilemma around a psychiatrist remains exactly the same. So it takes time. Everything, going to a psychiatrist is not a bad thing. Having a psychiatrist. So you know how many people have a psychiatric propensity? 9 out of 10. 9 out of 10 people have a psychiatric propensity. Everybody is what we say, a little different, a little weird in their own ways. Everybody is. And then 1 out of 10 people has schizophrenia. But in Pakistan, you would ever imagine thinking, no. For example, if I had 372 people in my class of Dow Medical College, that means how many people would actually have schizophrenia amongst my class? So if I have 400 people, 10% or 40 people or something would have schizophrenia. It's not something to be like, for example, if you have in Western countries, admitting a psychiatric illness is considered better than a medical problem. People don't want to share they have diabetes. They just want to say, I'm fit, I'm fit, I'm fit. So different cultures, different problems, but awareness is always a good thing. Neurodiversity is what we are. It's the spectrum of all human beings. It's
very,
all
very
normal.
nicely said, Arima. It's I think it's spectrum of all human beings. That's a very nice sentence to put it in. And Areeba, how would you compare? I'll just wind up the session now. Then how would you compare working over here and then over there?
Pakistan versus Western countries.
What is the one thing that you would wish was here and what you have seen over there?
Honesty.
Honesty?
Yeah, it's very hard to find honest doctors. There's so many things that I would change if I was working in the psychiatric department. I don't know how they operate. It's just beyond my comprehension. I don't think I would ever be able to work in an environment like that. I would rather leave it and stay jobless than work in an environment like this, because they have no understanding of who needs to be treated involuntarily, who needs to be treated voluntarily. There are a lot of problems in the big, but I've only worked in the government sector. So what I'm talking about is not the private sector. I'm assuming private sector
but
is
you are talking about the sector in which most of us are exposed to more. I think our percentage of the people go more to I think semi-private or government hospitals than compared to private.
Semi-private is even better, and there are some people who work really good. So, for example, I studied from DMC, and for DMC in our child psychiatric rotations, we go to IPMR, which is slightly next to DMC, and IPMR is so good. The person who runs it is so good. And there are good people even in government settings.
IPMR, so, those who don't know, it's an Institute of Physical and what was the full
physical
form?
Medicine and rehab. As far as I know, it's physical of medicine and rehabilitation.
Yeah.
So
I take my son for occupational therapy over there, and they are so well equipped and very well trained, and they're not even charging much.
So it really depends how you look for it. There are good things and bad things in every culture. Our culture has a lot of good things. It has certain bad things. We can navigate around it if we'd like.
Yeah, definitely. Anyways, thank you so much, Areeba. It was, I think I have learned, I have cleared so many concepts. I'm quite sure my members would have cleared their misconceptions too. And those who didn't see the live stream right now, you can watch it anytime. It will be on the page. And then if you have any queries, just comment below and Areeba would answer that, or I will get back to you. And anything else, Areeba, you want to say? I'll just say then.
Not really. Best of luck to everyone. Keep trying hard, and everything's gonna work out for the better if you keep trying.
Inshallah. Okay, but thank you so much.
No problems. Take care. Bye.
Bye. Okay, guys, that was Dr. Khushbakht Areeba, and she gave a very insightful session. And I'm quite sure she has cleared basic questions that we are not able to figure out on our own, and we are not able to figure out with a proper physician, proper professional, because misguidance sometimes take over the proper guidance, where we have to go to, what is the next step. And I think this video would help you out with that. If you have any questions, I'm saying again, just leave in the comments below, and Ariba will get back to you. I hope everybody will benefit from that. Anything else, if you have any feedback regarding this, if you want a particular topic that you would like Ariba to talk about it, just let us know, and definitely I will plan accordingly. And take care. Allah Hafiz.